So welcome back, everybody. I hope you had a good lunch. I mentioned at the beginning there were two things that, on behalf of Antibiotic Research UK, that we wanted to highlight and launch today. So the second one is the Research Priority Setting Partnership for UTIs. And this is something that some of you may be familiar with. This is a concept. We're working with the James Lind Alliance, which is an organisation based at Southampton University, but part of the National Institute of Health Research. And it was established shortly after the turn of the century, named after a pioneer of clinical trials, James Lind. But it's very much about bringing together a formalised, methodical, transparent, sort of ethical network of patients, carers, clinicians, healthcare professionals, researchers around looking at a particular disease area or a particular issue, understanding what the evidence base is for the issues so far, what's missing, what needs to be added, what needs to be reconsidered maybe, and really identifying clearer evidence or answers to unanswered questions, or providing evidence for these unanswered questions, to draw together a list of it's often referred to as top 10 priorities, but it doesn't necessarily have to be 10, but essentially a list of key research priorities based upon that partnership work between those groups of patients, carers and clinicians predominantly, and also researchers. And it's got those principles around being very transparent about its methodology and who's involved. Everybody is seen as an equal partner, so it's not distorted or imbalanced by a particular set of professionals or a network or a sector or whatever. And around it, it's also trying to link with the wider networks and communities, whether they are patient-led or professional-led or whatever, so that everybody is involved and everyone has a say. So it's really important that that's how it's approached. And we are interested in setting up one for UTIs, and this is sort of formally today making an announcement. This is what we're doing. We've partnered with the James Lind Alliance around it. We've had our James Lind Alliance advisor appointed to us, and really I'm talking to you about this as part of our engagement. So if anyone is interested in becoming part of this, see the contact details at the end of these slides. But it is just focused on these aspects which I've just sort of introduced on the earlier side, but it tends to be very focused on a particular condition. We think this is missing from UTIs. We've heard from the speakers already and the presentations we've had about things that aren't clear, aren't uncertain, things that need to be developed, things that are missing, and we think this is ripe for this area of work. We're very keen to do this in partnership with the people as well. So outside of this, I've been talking with a couple of the other organisations that are patient organisations that are involved in this field, and we hope to be able to do this as a joint partnership with 2 or 3 other patient charities, and we should be able to announce those partnerships shortly, but not in a position to have them formally approved yet. So in terms of process, a JLA priority setting partnership works like this. You have your advisor appointed, which we have in place. The key thing that drives it is a steering group, which is meant to represent the key organisations, the key clinicians, the combination of the opinion leaders, but also all the representative parts of, in this case, the UTI sector, whether that's from patients, different organisations that are working with different focuses, doctors, nurses, other clinicians, other healthcare practitioners, researchers, and so on, and making sure that you're representing all the different parts of the community, whether that's across the UK or different backgrounds and ethnicities and so on, bringing that together and making sure that's focused. What tends to happen in practice, seeing it work in other disease areas, is the steering group is at the centre, and you in effect have a sort of set of concentric circles around the steering group of different networks that are brought in and consulted as part of the process, which becomes very iterative because it's asking lots of questions, doing literature reviews, reviewing existing evidence, and then sort of bouncing back the findings from that, collecting new information and so on. And it just goes along this sort of track, but quite often, as I was saying, iterative and bouncing back and forth to check with the different stakeholders, check with the steering group, analysing new data or evidence reviews and so on. And it goes through then a consultation process through the steering group and the associated networks to come up with a prioritised list of research questions, which are finalised and then publicised as widely and as far as possible, including to anyone that's interested in funding research or carrying out research in this area, in this case UTIs. So what we will be doing, this is the official launch. We're hoping to get together a steering group over the next couple of months with a view to holding the first steering group meeting in May or June. And we will then go on to go through the process I've identified, and hopefully in a year or so, maybe a year to 18 months, we will have our list of top 10 priorities. That will certainly guide our work. We hope it will guide and influence other organisations that are involved in UTIs and AMR, and sort of determine the key things that we should be looking at and answer some of the questions and some of the issues that I think are being raised today. And just a bit of feedback from people that are directly involved in other JLA PSPs. I then learned of the opportunity to participate in the UK Epilepsy PSP workshop and felt that I could add huge value by not only representing other parents like myself, but giving my little girl a voice. So you can see how they are very powerful. It's a powerful tool. This has changed how I practice medicine. It's changed my understanding of what it means to listen to patients. It's changed the language I use when I speak with them. Most importantly, it's changed my vision of how to deliver the care we give them. It has made it our vision. So two sides there, a sort of a user-patient perspective and a professional perspective. So again, if you're keen to know more or be connected with it or be directly involved in it, perhaps you might be a steering group member, I don't know, we'll see how that works. Get in touch. So thank you. I'm going to move on now.